The internet is full of bro science, fake knowledge, half information, or propaganda. Your quest of reliable, authentic health information ends here. So subscribe this channel and hit the bell icon, and you never have to go anywhere else ever again.
So hi, this is Dr. Paramjeet. I am a consultant physician and a cardiologist in Yashoda Super Speciality Hospital, Nehru Nagar, Delhi NCR. And today we'll be talking about why people are getting more and more heart attacks these days, and what can you do to assess your risk and to prevent yourself or your family members from getting a heart attack in the near future, right? So how can you do that, and what is a heart attack? We'll be covering the causes of heart attack, and I'll be explaining you what major risk factors which you are already might be doing in your life and might be having in your life, which will put you in a major risk to get a heart attack in future. Okay, so let's understand, when we talk about heart attacks, we're basically talking about blockages in the blood vessels of the heart. And heart is, it's just a muscle. Okay, it's just a muscle which has automated tissues. It cannot stop. If it stops, basically you die. So any muscle needs blood supply to work, right? So heart is a muscle and it pumps blood, but that blood which it pumps does not actually supply nutrients to the heart itself, right? There is another blood supply which is coming from the surface of the heart, and which basically supplies blood and nutrients to the heart muscles. So basically there is a different blood vessels for the heart. Okay, and these are called coronary arteries. Well, name doesn't matter, but the concept matters. Concept is that there are different blood vessels, and such blood vessels, they supply blood to every single organ of your body, including your lungs, your liver, and your brain, your skin, every part. So what exactly happens to you which leads to a heart attack? So basically some people, they blame the diabetes, they blame cholesterol, sometimes they blame smoking, but all these are different things, right? What is the primary reason? What is the main reason which is triggered by all these conditions, all these risk factors? So you need to understand that all these blood vessels are basically also made up of smooth muscles, and they also have a tendency to contract and expand, right? That's how your body increases blood supply to their organs during exercise and reduces blood supply to some organs like skin in winters to conserve heat. So basically what I'm saying is, heart is a muscle, blood supplying blood vessels are also muscles, and there is an inner layer of that muscular circular, or you can say the blood vessel. It's like a pipe, and pipe will have an outer layer and an inner surface basically. So the main inner surface of this blood vessel, the pipeline, is called the endothelium, because it's inside. So endothelium is the epithelium which is inside the blood vessels. So what is the problem? Why some people have blockages in their heart, some people don't, some people have less blockage, some people have more blockage? What leads to this blockage? The main reason is this endothelial injury. Okay, this inner surface of the blood vessels of your body, of the, it doesn't matter whether it is your heart, it's your brain, it's kidneys, it's your leg, anywhere, and there are like millions and millions of blood vessels in your body, and one of the main organ is heart, which cannot stop. The other organs, they get rest, they can stop and do work, but heart cannot stop. So blood vessels have inner surface which is called endothelium, and endothelium, whenever the endothelium gets damaged, we call it as an endothelial injury. Okay, so endothelial injury is just similar to a scratch which you get when you fall from a bike or from a bicycle. It's like a scratch. So it basically peels off the protective layer of epithelium, or the skin which you call the outer skin. There is an inner skin, so it peels off the skin, and it leads to a little bit of blood leakage, right? Just like reddish color comes when you get a scratch, sometimes you can get drops of blood, and then it stops. You've seen it stops, it clots, and there are like scabs, or what we call as a clot, which form, and there is a thick brown colored, sometimes black colored layer which forms over there. So that is the same thing which happens inside the blood. inside the blood vessels, right? So inside the blood vessels, whenever there is anything which causes endothelial injury, there is injury and there is bleeding, and there will be activation of all these clotting mechanisms, platelets, cholesterols, fibrins, and all these things which are meant to clot the blood go there, and they stop the bleeding, they fill the injury, and they fill the injury with cholesterol, platelets, other fibrins, and they form something called as a plaque. Okay, initially the plaque is small, but whenever there is a plaque, it's a sticky place. I mean, there is always a tendency for the plaque to get bigger, because whenever, like I said, this blood vessel has a tendency to contract and relax. It's not fixed, and whenever there is an injury, consider an injured blood vessels dilating. Consider that the injured blood vessel is dilating, it's expanding. Obviously the tear, the injury will expand. Obviously the injury will expand, so the size of the injury will increase. The endothelial injury size increases, so does the size of the plaque increases, because your body cannot allow your blood vessel to break, right, to burst. If your blood vessel bursts, you might die. If it is a bigger blood vessel, there will be internal injury. You will not know where the blood is going. If it bursts inside the brain, it causes a hemorrhagic stroke. If it is some like bursts inside the heart, there is blood which gets accumulated around the heart, then stops the heart. So it's a dangerous thing. So therefore there is a mechanism inside your body to prevent bursting of the blood vessel. That's how it does. Okay, so the main factor here is endothelial injury. So who causes this endothelial injury? And these all factors which we basically say, there's smoking. The smoke has more than 7,000 chemicals, out of which like at least few hundreds are carcinogens. They are cancer producing substances. And smoke by itself increases inflammation inside your body. And what is inflammation? Inflammation is like cytokines are basically the army and police and other people, right? Obviously, imagine if you have a crowd of army and police people outside your house and they are angry or they are fighting the enemy or whosoever, obviously there will be some damage to the boundary of your house, right? Same can happen. Same thing happens whenever there is any inflammation, and whenever your body is fighting any infection, there is collateral damage of whatever the area, whatever the reason the fight is going on, right? Same way, if you smoke, if you regularly smoke, or then there is increased amount of inflammation in your body. Whatever is usually happening in a general person, smokers have more inflammation, so they have more number of endothelial injuries, and over a period of time their elasticity of those arteries, they reduce. So when the elasticity is reduced and the artery stretches, there will be a bigger tear, there will be a bigger endothelial injury, there will be a bigger plaque. So smokers have bigger plaques, they have more chances of blockages, they have more chances of heart attack. That's how it happens. So the more you smoke, the larger and you can say the bigger amount of risk you have, right? The less you smoke, the less amount of risk. If you don't smoke, obviously that particular risk reduces. That does not mean person who does not smoke will never get a heart attack, because this is not the only reason, right? This is not the only reason your endothelium can get damaged, your boundary of your house can get damaged. There are so many things, right? And there are diabetes, high sugar. If it stays inside your blood, obviously it's going around in the blood vessels, right? If it stays inside the blood, it causes inflammation by itself. High amount of sugar, if it stays inside your blood vessels, it causes inflammation. If that person smokes, double inflammation, right? And if that third person has, you can say, high blood pressure, that means inside the blood pressure inside the blood vessels is high. That means whenever there will be a crack, there will be a little bigger crack, obviously, if the pressure is high, right? So high blood pressure increases these endothelial injuries, diabetes increases endothelial injuries, smoking increases endothelial injury, obesity basically puts a lot of stress over your body. If you are 10 kgs, 20 kgs overweight, right, your body is always carrying that load of 20 kgs over your heart, over your body, and you will have higher blood pressure, you will have higher body mass, you will have higher pulse rate, you will have more cholesterols, because all these are a part of metabolic syndrome, basically, which we call as the combination of obesity and the waist circumference, inactivity, right? And the biggest thing is what you call as a, I haven't mentioned cholesterol, because there was a time when people used to blame cholesterol, just the cholesterol. Because why? Because wherever there is an endothelial injury, who is going there and helping to, make the plaque? It's the platelets, the cholesterol, the fibrins, and we need the platelets, because who will stop the injury which is happening outside the body if we don't have platelets? So people think, okay, we need platelets, we cannot reduce platelet count, or else there can be bleeding, so we can reduce cholesterol. So if that is above the normal range, if you have very high cholesterol, obviously we should keep it in the normal range or in the lower side. And that's why people give you cholesterol medicines, they give you diet. And the best way to control cholesterol is diet and lifestyle, exercise, eating a lot of fruits, fibers, salads, right? So, but still, if you have a very high cholesterol, medicines can be given, should be given for some time. But that does not mean that if you control cholesterol, plaques will not happen. They will still happen. Because even if there is less cholesterol and there is bleeding inside, there is endothelial injury, your body has to seal it. Your body has to make a plaque. Less cholesterol, maybe there will not be a huge plaque, but there will be plaque. Alright. So, if you keep the cholesterol in control, maybe a little risk reduces, maybe not. Because if you have a less amount of cholesterol, still you do smoking, diabetes and all other bad things, still a lot of injuries can happen, still you can develop a lot of plaques and a bigger plaques. So cholesterol is not a major factor. It was thought to be in the past, but now it's not. Okay, but still, the cholesterol is a primary thing which you should check regularly. If your cholesterol is very high, obviously you're not having a good diet and lifestyle. That is a marker of that. If you have a good lifestyle, your cholesterols will be in control. So, to assess your lifestyle, you should do cholesterol test, and if it is really very high, specifically the LDL cholesterols, then definitely you should change your lifestyle, or if needed, take some medicines for that. So cholesterol is a factor, not the biggest one, because let me tell you, when research was done, if you see research, right, more than 65 or 70% of the heart attacks which have happened, they had normal cholesterols, right? So that does mean that cholesterol levels are not actually the primary reason, right? So who is the primary reason? Those are the factors which lead to endothelial injuries. So who will lead to endothelial injury? Any kind of disbalance, imbalance, any kind of restlessness, any kind of issue which leads to more inflammation in your body, including COVID, including viral infections. If there is people heard during COVID, during the higher amount of inflammation, the more amount of clotting was there. People associated COVID and even the vaccine with clots, heart attacks and strokes. So yes, any kind of inflammation increases your risk of plaques. So these are the factors. Then there are many more factors which keep on adding over the period of time. Like currently, just a few months we can say back, sleeplessness, insomnia was also added, or lack of sleep was also added as a factor, a big factor for heart attack. So if you don't rest properly, if you don't take proper sleep, then that increases inflammation inside your body, increases inflammation in the blood vessels, increases endothelial injury, increases the plaque, increases the chances of heart attack. So good sleep is needed, good diet is needed, good lifestyle is needed. And if you are obese, if you are overweight, if you don't exercise, if you have a sedentary lifestyle, that itself is one of the biggest factor. Sedentary lifestyle is the key reason behind diabetes, behind obesity, behind high blood pressure, behind many diseases. So the factor which starts, because sedentary lifestyle starts like 5 years or many years prior to the onset of all these diseases, or maybe 2-3 years prior to the onset, maybe you can say. So if you are having any of these, if you are not exercising regularly, if you are obese, if you are smoking, if you are having diabetes, and the bigger thing is family history. Genetics is also one of the big factors. Genetics is so important that if you or your father, mother, your parents or their parents, from your mother's side or father's side, if they had a heart attack, then you have a risk of getting a heart attack around or earlier, as the earlier than them. If they got a heart attack, any of them got a heart attack at 60 years of age, then you have a risk of getting a heart attack at 50 years of age, or 50 to 60, between that time, because the environment is getting bad, right? People who don't smoke and live in metro cities, they inhale so much pollution, so much polluted air, that the inflammation inside the body is rising. Then people are concentrated on earning their jobs and their deadlines, not on their health, not on their diet, right? So we need to understand, relax, and step back and look for what we are doing wrong in our lives. If you don't do that, then you never know what you are, where you are headed. You might be doing something wrong, or there might be some insulin resistance or high sugar going on, or maybe high cholesterol going on inside your body from years. If you haven't tested, then you will not get any symptoms, right? High blood pressure, borderline high diabetes, cholesterol levels, if they are high, they will not produce any symptoms, zero symptoms. You will feel just, sometimes you'll feel weakness, sometimes you'll see, okay, I'm not able to sleep, I'm not able to concentrate, but you don't get any major symptom, right? So the only thing which you can do is re-evaluate your lifestyle and do checkups, and then see if you have any history of heart disease in your family. Then it's very important for you to do these checkups, right? To be connected with a good doctor, with a good cardiologist, regularly consult a doctor, right? And you can regularly, yearly basis, you can do tests, health checkups, so that your body, cholesterol levels, sugar levels, blood pressure, heart compliance is under control. You can check your CRP levels, whether the overall inflammation in your body is under control. So if any marker is abnormal, it suggests there is something wrong. You should even know, even if your RBC count is high, your red blood cells counts are high, your platelet counts are high, all these can lead to increased number of clots being produced in your body. Many infections are there which are regularly coming, including recurrently coming variations of COVID, which can lead to increased amount of clots in your body, right? Maybe if 100 people, even if it is mild, a viral infection, not even if it is not COVID, some other infection might increase the risk of clotting, right? Even if one person out of 100 gets increased risk of clotting, it's a huge number, right? 1% out of 100, 1% is also huge. I mean, there are millions of people in the world, right, who are not taking care of their bodies. So where do you stand? Have you done a health checkup, a cardiac health checkup in the last maybe 1 year, 2 years? If not, you are ignoring your health. If not, you are ignoring your health. Do you have an exercise routine? Do you sleep well? Do you drink enough water? Being dehydrated is basically putting your body at a higher level of inflammation, right? Whenever there is some fire, you have to extinguish it with water, right? Whenever you feel hot, your body demands water. It signals your brain that go and drink water. When you are thirsty, when you feel thirsty, you are already dehydrated, right? So ideally, a person should not feel thirsty. He should drink that much amount of water, and it depends on the person's activity, on the temperature of that area, on the person's body mass. So anywhere between 3 to 4 liters of liquids, any liquid, are required for a person throughout the day. Some can be water, some can be any kind of juice, milk, tea, coffee, everything included. So we all need to understand the concepts of human body, which is not being taught to us in schools. Ideally, it should have been, right? It should have. I mean, this is so important, right? This is what determines whether or not we will have a heart attack in the next 10 years, whether or not our mothers and fathers will get a heart attack in the next 10 years, right? So it's very important for you to reassess your lifestyle and find out if there is one factor in your life which can increase inflammation or endothelial injury in your body, right? So let's revise. What are the causes of endothelial injuries? What are the causes of building plaques? One most important is your genetics, right? So if you have it, you will get it. I mean, if you have it in your family, there is no way of preventing it. I mean, you can push it away 10 years, 20 years by proper lifestyle, but you will definitely get a heart attack, right? If you have a heart attack, history of heart attack in your family, then only thing you can do is live a good life so that you die of some other reason, not heart attack, right? That's what you can do. So, but genetic predisposition is a big factor. So make sure that you ask your family and re-inquire whether anybody had a heart attack. If yes, then you are at risk. That means you cannot ignore your health. It means you need to get a health checkup every year, which needs a heart evaluation, including echocardiography and ECG and TMT, treadmill test, right? And cholesterol levels, CBC, ESR, CRP, inflammatory markers, liver, kidney, all thyroid, everything can be done. But these are the important things. Then you should take at least 7 hours of sleep. 6 hours is bare minimum passing marks. Nobody wants to be at the passing mark level of health. Why do you want to be at the passing mark level? You should be at optimum health, right? At the best health. For the best health, you need 7 to 9 hours of sleep. 7 is perfect. 6 is bare minimum. 5 is bekar, useless. I would say it's not enough for a person. Well, some people can adapt to 5 hours sleep, but they will not really know what they are missing. They might get delayed reflexes, delayed judgments. They might get easy infections. They might get more higher number of inflammatory markers in their body. So there are side effects of things, and that's why recommendations are made. So there are only a handful of things which you need to make sure that you are doing. Good sleep, a lot of water, right? So much so as your urine should be white or whitish, right? Most of the times. One or few times maybe it comes yellow, but if it is dark yellow, if you are thirsty all the time, you're not drinking water. You're not drinking enough fluids. You are dehydrated, right? And then you need to do your health checkup and you need to start exercising. It's a simple thing. Sleep, drink water, exercise every week. The recommendation says, so if you exercise, minimum amount of exercise which you need is 2.5 hours a week of moderate exercise. And if you do vigorous, heavy exercises, running kind of exercises, then you can do only 1.5 hours a week, 90 minutes a week. In 1 week, that's not too much, that's very less. So that's a minimum exercise which you need to do, but ideally you should do half an hour every day, maybe 1 hour every day. You can give 1 hour to your body every day. And you can play sports, you can go for swimming, you can do horse riding, you can do any kind of thing which you want. You can do any sports, badminton, cricket, anything which you want. You just make sure that your body is getting some exercise for half to 1 hour, right? And then drink a lot of water and then get a good sleep. And then you can concentrate on earnings, right? You have to earn to live, that's fine, right? We all are here to earn money. But the priority is health and safety, right? What's the point of earning money just to give to the doctors or the hospitals? Doctors don't really get so much. I mean, all right. So the point here is that there are things in your hand, and there is something called as natural bypass also. What is that? See, let me take an example of army people, right? So you must have heard or seen many times the soldiers in army, they regularly drink and smoke and they exercise, right? And they live in extreme conditions. Sometimes they live in they have to stay there for months or weeks. But the point is, they don't really get a heart attack during the army, during their the service ages. Never, right? They a very rarely they might be some 1 out of a million person might be getting, but ideally they are exposing their body to so much smoke and toxins and other things. But the one thing which they do is vigorous exercise and regular exercise. So what does that show us? That shows us that your body, right, it's just like exercise is just like the cleaning process which goes on in your house after a good huge party, right? If you do if you party every week and you don't do cleaning in your house, you won't be able to live at your place after a few days or few weeks, right? But the more you party, the more cleaning is required, the more heavier cleaning is required. Same thing, exercise. What does exercise do? It basically increases your heart rate, your blood pressure, blood flowing in your kidneys, which basically flushes out the toxins, your blood flowing through your liver, detoxifications, and it induces thirst. You drink a lot of water, induces sleep, you sleep well, induces hunger, you eat a lot. So exercise is one factor which allows you to enjoy your life, right? If you really want to enjoy your life, you want to drink sometimes, you want to go out, have some outside food, then yes, you need to exercise also, and regularly. The more you exercise, we have seen people who are running marathons at the age of around 80, 90. I mean, people who are exercising, they have a great physique even at 100. So having a physique at 80, 90, 100, these are examples of what exercise can do to your body, right? And regular exercise is very important, especially after the age of 40. So important. Regular physical and strength training, so even to maintain your muscles, right? To maintain your muscles, to maintain your bone strength, so that you don't fall, break your bones in the later life, right? So regular exercise is so important. We don't do that, right? We just do that in our 20s and then forget about everything in our 30s. After marriage, after children, we are only considered, only worried about our time in the in the offices and our time with our friends, right? That's it. And so that's not how things work. That's not good. That's not healthy. So you guys, everybody needs to think back what wrong you are doing. Then there is exercise is very important, and there is one more thing which I wanted to talk about was outside food, right? So we have just mentioned a few risk factors. Mind well, there can be 10 more risk factors, including if you are living besides the radiating kind of a factory, the radiations from the factory, the chemicals from the factory, if you are eating adulterated food, if you are not having good quality of, if you're not drinking good quality of water, if you're not having, I mean, there are so many things which can damage your body, right? There are so many issues which can come, and right now, these are the basic things which I am saying, which are documented, which are easily controllable. There are many things which you might not know, which you cannot control, but these are the things which you can. And eating outside is also very big factor. When you eat outside, or consider this, if you have your own restaurant, or so, and you are giving them a healthy food, it will, and somebody else is using a lot of butter, a lot of high heat, right? What does high heat do? Because you might have seen the restaurants have big stoves, right? Our home stoves are very small, and the restaurant stoves are big. So it produces so much, a big flame, and the food is cooked within minutes. And that high heat, it basically burns the surface of the food sometimes. Barbecue burns the surfaces blackish, including the whatever you barbecue. What does that do? It increases the production of trans fats. The higher amount of heat
ఫోన్ నంబర్ కూడా
increases the production of trans fats. Okay, so this trans fats are very tasty. That's why we like restaurant food more than our household food, because restaurant food are cooked with more oils, more butters, and more heat. That's why there is a higher amount of trans fats inside the restaurant, and many times MSGs and other food additives are used so that your food just tastes very good, but they are not really healthy, right? It might be okay to eat once in a while, once or twice a month, but not if you're eating regularly outside, then again you are putting your body at a risk of higher amount of inflammation, higher amount of endothelial injury, which can lead to problems over the period of time. So these are very important points which you need to understand and take note. Okay, and look into your life and your life of your loved ones, and then reevaluate what you are doing wrong, where you need corrections. As far as your heart is concerned, your blood pressure, your sugar, your cholesterol, get them checked every year, and consult a good doctor and be corrected with a family doctor. So these are the important things which I need to tell you.